So that's interesting. There's a lot of discussion about the words we use in patient involvement, and in my understanding, engagement is something less politically powerful than empowerment. Empowerment suggests somebody who has control and power over what they're doing, but I would prefer to see it as a continuum, a ladder, if you like, of progressive involvement from something quite passive and receiving to something quite active and giving. Because we see healthcare differently. We've shown that several times, because where we make decisions about healthcare is often where people occupy places of power and prestige and are often very qualified, but they may not necessarily understand the needs of people who use the system. And finally, because I feel that we have always going to have a limited amount of money to spend on healthcare, so we need to work out what really matters to make that healthcare count for patients. And we only know that if we ask them. Sure, there's loads and loads of examples of successful involvement. I think it depends on where you see that involvement having the most impact. And for my practice, for the last 20 or so years, I've worked in areas where big decisions are made around what we're going to fund for research, what outcomes we're going to choose for our research, how we're going to design a healthcare system. And I think that gives us the best value. But there are lots of examples of patients being involved in helping to design clinics, to design clinical trials. There's so many examples. So this is a particular area of interest of mine, and I helped to found something called the James Lind Alliance 10 years ago, whereby we developed a method and a model for doing just that, and we've now involved over 40,000 people in those processes. There's been 67 partnerships in the UK and actually internationally. And we basically start with a blank sheet of paper. We say, what is it that people think is important? And we work up from there. And it's like a pyramid. We work from a lot of data to 10 important questions, and they're the ones that we promote for research funding.